decided. I'm going to have ear pinning surgery for the second time. I wasn't satisfied with the first one at all. I'm quite fed up. I'm going to have a revision surgery. I've been aware that he would have revision surgery for almost 8 to 9 years. Today is the day. I hope it goes well.
Do you have any worries inside? The first one was bad.
Actually, I trust Dr. Ali. He has given me a lot of confidence. I've been following him for many years, but since he will have surgery again, etc. That's the reason I have some unease. I sincerely hope it goes well.
Let's move on to the surgery.
Thank you very much. I appreciate it. Everything was fine. It didn't go as I wished. It opened after a month. Of course, it was a bit better than before.
How many years later did you decide to do it again?
But it's been quite 13, 14 years since then.
Were you with Ali Hoka during this process on YouTube?
Absolutely. I followed on both Instagram and YouTube. Once Instagram became popular, I continued my activity there.
Certainly, we should avoid labeling it as a mistake. The term mistake tends to elaborate on the intention. All of our medical colleagues are making every effort to perform at their best. However, it is sometimes the details that bring out the differences concerning nuances. I noticed that some folds were not made in our current patient undergoing surgery. I also observed that some folds were less pronounced. Of course, there are differences in the suture materials used by every physician colleague. In my opinion, the variation in suture materials is one of the factors that can influence success. I can't say it's incorrect, but it's more about preference and choice. However, fundamentally, in our patient, conceptually, during the construction of the folds inside the ear, there have been points that were somewhat overlooked or undervalued. Now we are trying to address those. Of course, when we perform revision surgeries, we need to clean the suture materials previously used in patients operated on at other clinics. It is essential. Otherwise, if we do not remove those suture materials that can cause sensitivity behind the ear, they can continue to cause sensitivities and pain. And then, to prevent patients from wondering if Ali Hoka caused this, we first clean those areas. Afterwards, we are once again completing our surgeries by shaping with a reduced amount of stitching material. We will show this to the patient shortly. As we display the image, meaning the immediate outcome we achieve post-surgery, I want you to observe it as well. Ultimately, I will request your assessment of the patient's surprise, questioning how this was possible. I didn't like this stitch. Hand me the scissors. That's how we are, dear friends. We always try to like the work we do first. When we like it, our patients tend to like it as well. We will always like it first. I will now refresh the stitch I made in that area to my satisfaction. I will replace it and create a new one. Once I am satisfied, I will confidently present our patient as the outcome of my work. Just a moment, please.
Patients who did not accept the revision, do they exist?
This happens sometimes, and I see it most in certain situations. I observe this in techniques that involve cutting or weakening cartilage. In techniques that remove excessive cartilage, the ear's shape will naturally revert to its original state. We cannot always shape it to that degree, unfortunately. Thus, there are times when I must genuinely tell patients, I apologize, but I cannot help this ear in a positive way. I must admit that there were situations in which I turned down the surgery or try to persuade the patient to abandon the operation. But I see this most often in techniques that involve cutting cartilage. This ear has been shaped now.
I really like it. It looks very nice. My ear was small. Let me
Let me pull it.
It seems large because of that.
Yes, the difference is now becoming clear.
My ear is small. It always looks big, so it seems tiny.
Making the folds inside the ear makes it appear smaller than it really is.
It was quite small, I mean.
This ear should be a little easier than the right side, which had a few more complications. At this moment, we will swiftly resolve this matter with a bit of skill. When your own ears are fine, it becomes quite simple to tell someone else that there's nothing wrong with their ears.
My wife has tiny ears. That's how it is. So my daughter is like that too.
Now your ear is the prettiest right ear in Istanbul. Once the left is done, they will both be perfect. We are lying about drawing.
Yeah.
They say we are drawing it.
I hear noises, but I don't understand.
The sound of the surgical pen. With such pink lies. The patients didn't believe us when we said the last surgery was over. Doctor, weren't you drawing? Patients aren't eating anymore, teacher. Sure, if you broadcast everything we have run out of rosy lies to say. Good luck with this.